Hi, my name is Raj, and today I would like to discuss a question. Should Canada open its international borders for non-essential travel during COVID-19? Though the answer to this question is either a yes or a no, it is not as simple as that. Allow me to explain the scenario to you. Canada's Minister of Health would like to conduct an analysis on whether Canada should open its borders for international leisure travel. Firstly, international leisure travel is tourism. Second, tourism would not only require Canada to open its borders, but also impose lenient internal restrictions. What would tourists do in Canada if there are strict measures in place? Finally, opening the international border for leisure travel means all non-essential movements will be permitted, which will make it impossible to control the spread of COVID-19. Will opening in the international borders provide any benefit to Canada and its population, or will it be the decision that costs many lives of many individuals? Is it worth taking the risk? There are two main schools of thought. One, the economy will prosper, and COVID-19 will have almost no impact on the daily lives of individuals living in Canada. Second, COVID-19 will prosper, and permitting non-essential international travel to Canada will come at a cost of many lives. Let's look at some relationships we could explore to answer our question. We can look at three key relationships that can determine what is the best course of action. Number one, the impact of policies and restrictions on COVID-19 cases. This will help us determine if very strict restrictions have any meaningful impact on curbing the spread of COVID-19. Though this relationship is obvious, we have to establish a foundation on which the other two arguments can rest on. Number two, the impact of policies and restrictions on the country's GDP and exports. This will provide us with the economical benefits of opening international borders. Note that there are many other economic indicators that can be helpful in exploring the impact of COVID-19 and its restrictions on the Canadian economy. However, due to the limited scope of this presentation, we will be looking at the gross domestic product, GDP, and exports of Canada only. Three, finally, the most important of the three factors, vaccination and herd immunity. We will understand what is herd immunity and how that one factor has the potential to make the tedious decision-making process very simple. So, what kind of analysis should we perform to understand these relationships and guide our decisions? For the analysis process, 8 different data sets were collected from 3 different data sources. It was a 3-step procedure that was followed for the data analysis process. Step 1, gathering the relevant data sets. This is the most important step as this will determine how reliable the conclusion of this presentation is. Step 2, cleansing and transforming the data sets. This step was carried out using Microsoft Power BI's Power Query. Finally, step 3 of the data analysis process was carrying out exploratory data analysis and creating visualizations to effectively communicate key insights from the data sets. Power BI was used to create visualizations. Okay, so now let's get started on our journey to answer the question, should Canada open its international borders for non-essential travel during COVID-19? First, let's attempt to understand how restrictions play an important role in controlling the spread of COVID-19. How do we even measure restrictions? Do we count the number of rules that a country has? Or do we determine the intensity of those rules? Thankfully, University of Oxford has already done the hard work for us. They have created the Oxford COVID-19 Government Response Tracker, which has an interesting index called the Stringency Index that could be used for our analysis. The Stringency Index is made up of 9 different metrics. To know more about the metrics, one could read the paper published about the tracker by University of Oxford. Let us look at how strict Canada's restrictions are compared to other countries in the world. On the world map, you can see that Canada has one of the strictest restrictions due to COVID-19. The darker the color, the stricter the restrictions, higher the value of Stringency Index. On the bar chart on the right, we can see that Canada comes in the top 20 countries, reasserting a conclusion from the world map. Let's look at how COVID-19 cases have changed with restrictions. So the first case of COVID-19 in Canada was reported on January 22, 2020. The Stringency Index was a low of 2.78. On March 2020, the government of Canada decided to impose restrictions on its international borders around the same time COVID-19 cases went increasing. In July 2020, Ontario entered stage 3 of its reopening framework. At the same time, Quebec changed the way it measured COVID-19 recoveries, causing a significant drop in COVID-19 active cases. Note, restrictions were now loosened as seen by the change in the Stringency Index. Between July and December, Canada observed a surge in COVID-19 cases as the restrictions were lowered. After hitting the peak at the end of 2020, COVID-19 active cases dropped continuously till March 2021. That's when Canada reduced its restrictions for a short period of time again. And as seen before, it started seeing a surge in COVID-19 cases. Finally, post May 2021, the active cases and the restrictions have been reducing. Keep a note of this. This will be helpful in the presentation later. So from this graph, we can see that there was some kind of relationship between restrictions and COVID-19 active cases. Hence, loosening the restrictions can cause COVID-19 cases to spike. Will Canada observe a spike post July 2021 as it has lowered internal restrictions significantly in the past 2 months? Moving on, observing the economy of a country can give a good indication on the health of businesses in the country. Let's look at the economical impacts of closing the international borders on the GDP of the highest exporting industries in Canada. In February 2020, the GDP of Canada's top 10 exporting industries was $326 billion. The international and internal movement restrictions were minimal. In March 2020, strict restrictions were in place due to COVID-19. And by April, the top exporting industries of Canada added only $257 billion. It was a 21% drop in 2 months. This shows that the impact of restrictions on Canada's exports was severe. However, in May 2021, the industry seemed to have adapted to the new restrictions. Not much changed in terms of international and internal movement restrictions, but the GDP recovered back to the pre-COVID levels. The graph shows that the impact of restrictions on international businesses in Canada was severe in the short run. But there is a sense of adaptability in the market as the GDP bounced back to its original value in May 2021. Hence, the general health of the economy seems to have recovered with businesses adapting to the new normal. And there is no sense of urgency to open international borders. However, the tourism industry took a big hit due to the restrictions, with a huge initial drop of 70.6% and a recovery to less than 50% of its pre-COVID value by May 2021. Hence, unlike the major exporting industries, tourism would require loosening of restrictions to get back to normal. Okay, finally, let's look at the final factor that will affect our decision: vaccines and herd immunity. Herd immunity is achieved when 50 to 90% of the population is immune to a certain virus. Measles, mumps, polio, chickenpox are examples of infectious diseases that were very common, but are now rare in the US because vaccines help establish herd immunity. If Canada has achieved herd immunity, opening the international borders for non-essential travel will have minimal effect on the spread of COVID-19 in the country. Hence, it would significantly reduce the risk of losing lives if borders are opened. Observe how COVID-19 active cases have peaked at the beginning of January 2021, and the vaccines were available to the general public around the same time. As mentioned earlier, usually herd immunity is observed between 50 and 90%. However, this is not a magic threshold. To observe herd immunity in action, we need to see a decrease in the number of COVID-19 cases with increase in vaccination rates. As 2021 begins, Canada starts observing a drop in COVID-19 cases until March 2021, when restrictions were lowered for some time. As soon as the restrictions were lowered, the number of cases started rising. Towards the end of May 2021, Canada achieved the milestone of over 50% of the population having received at least one dose of a COVID-19 vaccine. As Canada achieved this feat, there seemed to be a decrease in COVID-19 active cases. It is difficult to say whether it was the increase in restrictions or the vaccination drive that caused the reduction in cases. Finally, in June and July 2021, everyone who had received their first dose of vaccine started receiving the second dose, and the partially vaccinated population was converted to a fully vaccinated population. Canada had then achieved its second milestone of fully vaccinating 50% of its population. Canada has now entered the zone where herd immunity might kick in. However, knowing whether herd immunity is playing a role in decreasing COVID-19 cases is tricky. There is a possibility that the strict restrictions in place through April to June have an effect on reducing the active cases. Furthermore, the Stringency Index has reduced to the lowest value in the last year towards the end of July 2021. If the cases bounce back in the next month, it might have been the restrictions that have been moving the COVID-19 case numbers. Otherwise, Canada might have managed to achieve herd immunity with its efficient vaccination drive. So let's put it all together. We're trying to answer the question, should Canada open its international borders for non-essential travel during COVID-19? We have decided to look at restrictions, GDP of specific industries, and herd immunity to provide a recommended data-driven answer to the question. Three key insights were developed. Number one, changing restrictions changes the number of active COVID-19 cases. Hence, Canada's Minister of Health needs to be careful when loosening restrictions as it could threaten the lives of many individuals. Number two, impact on major exporting industries was catastrophic in the short run, but these industries managed to recover in the long run and achieved their pre-COVID values by the end of May 2021. However, the tourism industry's GDP in May 2021 had dropped to less than half of its original value before COVID-19. International borders need to be open to reactivate the tourism industry. And finally, number three, the vaccination and COVID-19 data has shown no concrete evidence that Canadian population has achieved herd immunity. So what is the recommendation? The ideal course of action would be to keep the current restrictions in place till there is more clarity on herd immunity in the population. Opening the international borders for non-essential travel can be very risky, considering the impact restrictions have on COVID-19 cases. Additionally, the country's economy is recovering and there is no urgent reason to open the international borders. Therefore, maintain current restrictions and keep an eye out for herd immunity. So the references. Thank you for watching.